Hi, my name is Becca Carrington. I'm a physical therapist here at Patterson Physical Therapy, and today I just wanted to talk to you a little bit about a different concept for the pelvic floor, which is more relaxation. A lot of times people are always thinking about, I gotta do my Kegels, I gotta strengthen my pelvic floor, and while that is true in most regards, sometimes the issue is not that the pelvic floor is not strong enough, it's that it is too tight and that it can't relax enough for it to do a normal contraction, or it can't relax and so you're feeling actually a lot of pelvic pain. So if you think about the pelvic floor and the muscles, it's kind of like a basket, and if those muscles are so tight that they're not able to relax, well then the muscle can't actually contract. And so if you think about even a bicep curl, if you're doing a bicep curl and you lengthen the muscle and then you contract the muscle, if you are only going here to here, then you're not using that muscle optimally. And so part of sometimes what you need to do is learning how to release those muscles and relax them in order to improve the contraction of them. And sometimes even leakage, incontinence can be caused and affected by the fact that you can't actually relax that muscle enough to use it correctly. So I'm just going to teach you a few tricks to be able to kind of relax and feel the pelvic floor relax and just work on that kind of concept. So the first thing we're going to talk about is actually just breathing. And a lot of people tend to take really shallow breaths. People get very anxious, people's bodies tighten up. So we're going to do just what's called diaphragm breathing, where you're just really focusing on those nice, deep, calm breaths. And it's just helping you to relax your body by also relaxing your pelvic floor. So one way to do that is to come in to this position here. And you're just going to lay with your back nice and supported. If this is not comfortable for you, you can always take a pillow and kind of put it under your back or hips if that helps you relax in that position better. You can also put something under your head if you need a little bit more support under your head or neck. You can even do it a little inclined if you need to. But in general, you're just kind of getting in a relaxed position, knees bent usually, and you're going to put one hand on top of the diaphragm, which is going to be just under the rib cage here. So you're going to feel those ribs and put that hand right here, and then put one hand on your chest. You're going to take a nice breath in. If you notice that when you breathe in, you feel this hand move quite a bit. So if I breathe in, and you see how much my top hand was moving, that usually means that you're just doing a lot of chest breathing and you're not allowing that air to just fully fill your system, and you're really using a lot of unnecessary muscles up here to get that breath going. So what you're going to do instead is really focus on this lower hand and see if you can just take some nice breaths in and only really feel this lower hand move instead of this upper hand. So if you can see that, you can see that my bottom hand was really the hand doing the moving and not my top hand, because I was allowing that air to come in through there and just lengthen the diaphragm and back down. I'm not pushing, I'm just allowing the air to fill it and then relax. And in doing that, you're also working on just letting go of that pelvic floor and just letting it relax along with it. You're not holding, you're not gripping your legs, you're not gripping your bottom, you're just letting it all relax with that. So in that regard, we're just working on the breathing, and then we're going to carry that breathing over while we do some kind of postural stretches. So one of the stretches is just kind of a butterfly stretch for these muscles leading into the pelvis. And you can just take your legs, put your feet together, and just let them relax out. Okay? If that is too uncomfortable for you, you can always start by just putting some pillows under the knees and let them rest on some pillows to have a little more support if you need to. You could start there and then go into where you're just letting them rest here. If this is too easy, then you can always increase it a little bit by bringing your knees in and then just gently pulling apart and going into what's a modified happy baby pose. And so you can kind of hold this here and just work on your breathing in and out, in through the nose, out through the mouth, and just relaxing in that position. If you're really wanting to get even deeper, you can go into a full happy baby, where you would come and go for your feet and then relaxing back here. If that's too much, then I would just start here and just pulling out. So that's one of the ways. One of the next ways to kind of work on some of that is doing what's called a child's pose. And this is to kind of help relax the back and into the pelvic floor this way. So you'll get on your hands and knees. You can start with your knees together and just kind of sinking down this way. If that's uncomfortable, you can take your knees and spread them apart a little bit, and then now sink in. And then you're just going to kind of hold that pose. And you're just going to, again, work on your breathing. And you're just letting your back and your pelvic floor relax with all of those. So those are some ways that I wanted to kind of show you to help work on some relaxation of your body, of your pelvis, of your back, and work on some breathing to help with that pelvic floor relaxation. As always, if you have any questions or concerns, please give us a call here at Patterson Physical Therapy. Thank you.